We're back!
And welcome to A Dose of Candor with Jay and Lee.
Alright, what are we talking about today?
Today, the episode is called Two Sick Girls.
Two sick girls, because we're two sick girls.
Literally, it's in the name.
But you're gonna go first.
Yes, I'm gonna go first. So why are you talking like we didn't plan out this episode?
Like we didn't prepare. Well, you know, just in case.
That just sounded like our episodes are scripted. Our episodes aren't scripted.
I mean, we have a general idea of what we're going to talk about each episode, but...
Yeah, we try to plan out, like, what topics, like, we want to talk about, since we get sidetracked.
Yeah, we're people that, like, when we're telling one story, we go into 20 other stories, and then we're like, wait a minute, why did we start talking about these stories? What was my main point? What were we talking about initially?
I know. My mom was saying that, because my mom obviously listens to, like, some of the podcast episodes, and she's like, yeah, I noticed with one of your episodes, you guys are getting really off topic. I think it was the Big Fat Liar episode that she said we were getting off topic.
Probably. But that's okay. I mean, it's relatable, I think. But yeah, yes. So we're going to talk about health ailments today, and to also kind of help bring awareness. Because, especially with you, because I remember I told you for months to tell your mom to take you to the doctor, and you just like did not listen to me.
Yeah, I was definitely pushing it off a lot.
You were like, it's not a big deal, it'll be okay.
Which I should have actually took it more seriously, considering heart problems run in my dad's side of the family.
Well, that, and you were having major symptoms, like your body was literally screaming at you with the symptoms it was giving you.
Yeah, it was like, go to the emergency room, which eventually I did.
Eventually, yeah. But okay, well, I'll let you kind of take it from the top.
Well, I think I should talk about what it is.
Oh yeah, for sure.
And I'm going off with the Google definition, which kind of, I feel like the Google definition is definitely what the doctors were basically summarizing it up.
Yeah.
So I have Castleman disease. Probably never heard of that before.
It is rare, you said.
Yeah, it says it's a rare condition that occurs when lymph nodes grow too many cells, forming hard growths.
Right. So they basically called it like a big blood clot in your chest,
basically,
right?
That's what it is. It's just a bunch of blood clots of cells right on in the middle of my heart and with the thing that connects to my lungs and stuff.
And I mean, obviously it's rare, the doctor said. Yeah. I know you said you have an older doctor, and they said that they've only seen it one other time.
Yeah, the guy who the doctor that I had first, not the one who did my biopsies or anything. Mm-hmm. He's I've been doing this for 40 something years and I've never heard of this.
Yeah, it's crazy.
Because obviously it's not something you look for, considering it's rare.
Right. I mean, that's why they had to do so many tests.
Literally. It's funny because I actually got a Facebook notification saying that it's been a year since I've had my open biopsy in my side.
That's crazy, isn't it?
It doesn't even feel like a year. But no. But I did end up telling my mom, and we actually had a doctor's visit because I needed my regular 6-month appointment.
Mm-hmm.
Yeah, there's a reason why she's saying.
Mm-hmm. I was not happy with that doctor. Well, because it was a sick visit.
Yeah, it was
in for a sick visit because of your symptoms. And they basically turned it into a wellness exam while you were there and gave you vaccines and everything.
Yeah, I got my vaccines.
What?
Which I feel something that is normal that they did is blood work, because anytime I go to my regular checkups, they want updated blood work.
Right.
And so obviously I did my blood work, and we told him there was I'm having chest pains. Mm-hmm. And obviously they feel you your heart area and everything. They're well, there's no lumps or anything, so there's nothing externally wrong with you. But they're basically saying that they were gonna, is it considered a specialist that does? Yeah. They were gonna refer me to a specialist to go and do a chest x-ray and stuff like that, and a bunch of other tests. But obviously I didn't make it that far because it hurt so bad. It's a sharp knife going right into your chest.
Mm-hmm.
That's exactly what I would describe the pain. Sometimes it's worse than that.
Yeah. Well, I know that like you would message me and everything because I have students who like to message me on Facebook since I don't teach anymore. But you were messaging me and everything. And I remember I was like, you need to tell your mom to take you to the emergency room like as soon as she gets home. And I think I told you to message her at work. I was like, no, you need to message her right now.
Yeah, because she was working late. And I was like, she's working. Like, I don't need to be doing that. And you're like, no, like, you need to message her. And then you threatened to message her yourself.
I know. I was like, I will search her up on this app.
Because the only reason you mentioned the app is I was like, haha, you can't because you don't even have her phone number.
I know.
And you're like, I can... Public records.
Right. But no, so your mom finally got home and...
And obviously, like, she got... Because obviously she's, like, in jeans and a t-shirt, and she's like, well, if we're going there, I want us to like be at least comfortable in what we're wearing, just because obviously when you're in the ER, you're in there for a while.
You don't know how long you're gonna be in the ER.
So she like quickly changed into like some leggings, and obviously she already had a t-shirt on, so she just put on black leggings and we left. And it's funny because when we were in the car, she goes, you better be dying.
Yeah, I remember you telling me that.
And then obviously like, so
she ended up feeling real guilty about really making that comment
because we went to the ER and they were like, well, nothing's showing up in your blood work, because they even like looked at the blood work from like when I went to the doctors,
right? And
then they did a chest x-ray. First of all, my mom panicked because she thought my heart was what they were looking at, but in reality obviously it was my heart, and they were like, no, that's her heart. But they did see something. It was like a big circle. They said it was bigger than a golf ball.
Yeah, I remember you saying that.
And realistically, compared to your chest, the golf ball is pretty big.
Right.
Like, in your heart and stuff. And so I did CAT scans and stuff. And then that's when they transferred me to the hospital. And I did a biopsy down my throat.
Right.
They basically just, like, sent a camera and, like, something to get a sample of what was in my chest, like, down my throat. And obviously I was under anesthesia, and obviously people react differently to anesthesia.
Yeah.
It's funny because my mom told me that there was a kid there, like, who just woke up from anesthesia, and he was screaming and panicking.
Yeah.
And I'm like, oh, thank God that wasn't me, because obviously, like, there's different, like, you react differently to anesthesia.
Yeah. Well, I remember because both of the boys have had multiple ear tube surgeries. And, like, I know, like, some kids just react to anesthesia, like when they wake up from it, like would be screaming or going crazy. Some kids, like, no problem at all.
Right. Mm-hmm. So, you know me, I feel like anesthesia I feel like I didn't say that right. But that just makes me tired. So that was the first biopsy I had, was the one down my throat. And then obviously the one I just said I got a notification for was my open biopsy, because they didn't think that they got a big enough sample because nothing was coming back on what it was at all.
Yeah.
And so obviously they're like, we're going to just like, we can just like put some like, they can like cut me open on the side a little bit. Like, obviously it's not like big, like what would you say? What's it called? Like big incisions.
Oh, okay.
Incisions. That's
okay.
Like, it's not like an entire like big line. It's like the smallest thing, because they're not sending like this big thing inside of you.
Right. I know your mom was like concerned about like possible scarring and stuff like that.
Yeah. But also something she was concerned about is the like medication and stuff that they were going to give me, because like the one thing that they wanted to give me is like a drug that obviously they sell on the streets, and she's like, no, absolutely not. She's like, is there something else you can give her? And they're like, yeah, like there's this, I forgot what it was, but obviously they gave me the other thing instead. But I remember waking up in so much pain. Something I didn't know, but my mom knew, is I was going to wake up with a tube in my side.
Right. I remember you saying that.
I genuinely don't think people who've never had a tube inside of them don't understand how bad that hurts.
Probably not. I mean, it's probably definitely one of those things where you don't know what it's like until you experience it yourself. Yeah.
I know. Especially, like, I feel like it also depends on where you got it. See, my grandpa, on the other hand, he was like, wow, you're lucky you only had one. I had 5.
Ooh.
Because when he had his open heart surgery, like, they literally put metal inside of him. It's so funny because I asked him if he were to walk through a metal detector, if it would go off.
Yes. Oh, my gosh.
But no, and I remember them taking it out and everything, and that just made me feel so much better. Because I was even talking to you, and I would have to, like, stop and like take a couple deep breaths, and even when I would breathe it would hurt so bad.
Yeah, I remember.
But
I mean, but at least you had some visitors, right?
Didn't like that.
Didn't like that.
Don't get me wrong, like when I had like my biopsy down my throat, my mom's boyfriend, which is my younger sibling's dad.
You're right.
I was trying to say my brother, but also like talk at something else at the same time. So I don't know why I said that.
You're like hubbity hoop.
Literally, like they were all there. Like my little sister was there. I think my little sister was there. Was she?
I have no idea if your little sister was there.
I thought no, she was with his grandparents.
I was gonna say I don't remember you saying she was there.
I think she was there like when I was getting my biopsy, but when I woke up, I don't think she was there. I don't remember. I would have to ask my mom.
I think that probably would have been a high risk scenario of like.
Yeah, Kylie would have been like trying to pull things and everything. And so, obviously my brother was there and everything, and so was my mom, because obviously
hoping to get like funny video of you or something.
I know he was like, I was really disappointed in your reaction, like when you woke up. And I was like, what do you mean? He's like, well, I thought you were gonna be crying or like screaming or like being funny, but you were just so calm and so tired.
Yeah.
I was like, well, I just woke up from anesthesia and had a camera shoved down my throat.
Yeah, I know when I've been put under for procedures, I welcome it. I'm like, yes, please knock me out. I'll see you when it's done.
See you later. See you on the other side.
Bye. But no, I don't ever react crazily at all either. And they ask you that, though, that like that's something that they ask you before is like, oh, have you ever had a bad reaction to any anesthesia? And it's like, nope, I'm good. Please drug me up.
Right.
But no, and I wake up just fine too. Like people never really get any funny video.
I think the only funny video he got was the fact that I said I can read military time.
Oh,
that's how long I was in there for. I could not read military time before, and now it's like
you're like
pull up military time, and I can tell you exactly what time it is.
I remember what they said that time was.
I know, which I don't understand because I learned it by myself. Like no one told me. I was in there for so long that I was learning it by myself. Because I would like ask the doctors what time it is, and they're like, oh, it's like 15 something, and I'm like, what?
Yeah.
And then I like would put it together. So I like kind of learned it by myself. But no, like I didn't really mind my grandpa and my aunt visiting me so much. But because obviously, like, especially my grandpa, because, like, he knows everything about it. So, like, he was kind of telling us about that stuff. Mm-hmm. But honestly, I just, like, even my mom. It's funny because I even asked the nurse because she started irritating me because she told me she wasn't going to fix my socks anymore. And so I asked the nurse, I was like, can I kick her out? She goes, hey, it's your room. You can kick anybody out if you want. I was like, Mom, get out. But she had to leave anyway. She was going to get me food. So I was like, you're getting out.
Oh, yeah. I remember her getting you food a few times because you didn't like the food from, like, the hospital cafeteria.
Girl, why was there sausage, a hockey puck? Like, no hate to them at all. It's just not my cup of tea.
Yeah. No, and I know we talked about, like, people visiting and how we feel about that. And, like, I'm kind of with you. I don't really like when people visit me in the hospital because I don't know. I always feel like I have to like oblige other people
and put on a
like,
show.
Yeah, like entertain in some manner, like a hostess or something would. So it's always like, I don't know. It's like I feel like I can't really rest and recover because I'm like, oh, hey, like, oh.
It's like in between the visitors and then obviously the nurses coming in your room at every hour.
Yeah. Oh my goodness.
And it's like obviously the nurses are there to do their job, so it's like you have no control over them at all. But it's like when people are like, oh yeah, I'm gonna come and visit you, and it's like, hey, yeah. But obviously, like with my aunt and my grandpa, I was like, I didn't mind because they have like the most knowledge on like heart things and everything.
Yeah, well, and I think like people that you don't feel like you have to entertain. Like I know if it were like my parents, I wouldn't care, or my own kids.
I know me and my grandpa sat there in silence watching TV the entire time.
Right. It's just certain people that it's like, oh hey, thanks for visiting.
But can you leave now?
Like yeah. But no. So what is your current treatment plan though, because they haven't taken it out yet.
Yeah, she's still in there. We actually, it's funny because one of my old teachers, she was like, it's like you got aliens inside of you. And so we sat there one class period naming all of them. We split it into like 3 or 4 of them, and we named them all different aliens. It's so funny because like one of my friends, she was like, oh my God, yeah, we need to name them. I was like, okay, I got you. And like she came up with like 2 names. I came up with the name, and then obviously that teacher was like, oh, you need to go with this name too. I was like, okay, we got my aliens names. But it's funny because that's what my aunt said. She goes, it's like you have an alien inside of you. And it's funny because my cousin goes, I want it. I was like, you can have it.
Oh gosh. Oh.
I was like, you can have it if you want.
Right.
She's like, I think she's like 8 or 9. Wait, no, I think she might be older.
Oh, well, I don't know, but it is interesting though, because like, you know, yeah, like they just don't realize when, you know, kids are younger how much of a big deal some of those things are, and it's like, no, you don't want it. You
don't want it. Even my aunt was like, you trust me, you don't want it. But now, my current like options that I have for like treatment is either to just monitor it, because obviously it's not growing fast, but it's obviously still
slow growing. Yeah,
it's slowly getting bigger, which it's definitely bigger than the last time I seen
I was gonna say, doesn't like the bigger it gets, the more difficult the surgery to remove it is going to be, and obviously the more complications could occur.
Oh my God, I should have let that burp out. That would have been our daily burp.
Your daily burp.
Don't worry, one's coming soon.
But no, didn't they want you to try like a medication, or an option was trying like medication to try to reduce the size of it?
It was like, but it obviously like even like the doctor was like, it's not like a slam dunk. It's not 100% chance. It's like a 50-50%
right,
chance.
it would either help reduce it or not.
And he's like, it could shrink or it could stay the same. Luckily, he didn't say it could grow, because let me tell you, that wouldn't have been an option. Well, for all. Wait.
I mean,
did I word that correctly?
Well, I mean, I think so. The longer it goes, I mean, they did already say it's slow growing. So no matter what you do, the longer you wait,
which is why, like, considering how big it is, they definitely said that I had it for a while,
right?
Because it like is growing so slow. And they said the other option that we could do is surgery for it, but they said the people like weren't comfortable doing it because of my age and how big it is.
Right. I was going to say,
that's something I don't like, is just because of my age, they don't want to do it. And but like, even like, because it's not the doctor who was talking to me about these options isn't like the doctor who was like telling me what it is. Even he's like, my doctor who was like telling me what it is and everything, he was like, mentally, you're like, your body is an adult, but like you're physically like a child.
Right. Like you're full grown,
but like physically you're a child.
But mentally
you're a child.
You're still developing, yes.
He's like, everything for you is developed except your brain.
Yeah.
Which obviously makes sense. But I was like, just because I'm like still like a child doesn't like mean you have to sit there and let it grow more and more, because then you're like not going to want to take it out at all.
Well, I hate it when they say that like because of your age, like, because I know with one of my issues, it was like, oh, you're too young to be having these issues. I mean, it's like, obviously I have it.
You're like,
but the doctor's like, but that's why I really appreciated one of my other specialists that I went to, because they're like, oh, like, well, yeah, you are too young to be having to deal with all these issues, and that's why I think you need to have surgery to get it out. Right. And it's like, yes, I like you. Please get this out of my body.
I know. So those were just kind of the options. And something I didn't like about the medicine, because obviously I haven't had the medicine because our insurance is not like accepting it.
Right.
But because obviously I think like what you said before, their view is if it's not 100% chance, why are we going to waste that money on that?
Right. Why would we spend thousands of dollars on this medication that there's no guarantee for it to work, when we could just pay for surgery and, you know.
But I know one of their reasons is like the type of medicine it was, is that they thought like they obviously were like, she doesn't need that. Because I don't know exactly what was in the medicine, but like even like when my grandpa heard it, he was like, what? like, I don't know exactly what the medicine was called, but even, like, me and my mom were going, like, back and forth on, like, ideas of it and everything. And I was like, well, there's obviously a reason why they're denying it. I was like, surgery is different because obviously me and her have gone back and forth on surgery.
Yeah, I know you really want to have the surgery. And I do kind of, I know where you're coming from, though, because it's like, yes, get it out. Get it out of me. Like, but, I mean, it's still causing you issues, too. And I think your symptoms have been getting worse, haven't they?
Yeah, they definitely have gotten worse. And I think what my mom's thing is because it's funny, she'll be like, well, you need to tell the doctors, like, if this hurts or not. Like, it's, like, your body. I can't feel what you're feeling.
Right.
And it's funny because I'll end up throwing back in her face. I'm like, you can't, like, feel what I'm feeling. So how are you going to tell me whether or not I should get the surgery? If it's, like, if I feel like I need the surgery...
Yeah,
like, no, I should get the surgery.
I would definitely, I mean, and you're old enough, in my opinion, you're old enough to make that judgment call. I mean, I do feel like you're definitely old enough to where, you know, what do you want? What do you feel is going to help you the most? And especially if it's an option that the doctor's office gave you. I mean, yeah, I mean... I probably, if you were my own kid, I probably already would have been like, let's set up the surgery.
It would have already been done.
But I mean, my own kids have had to have multiple surgeries just because like they've had really big ear problems down here in Florida. And so, I mean, goodness, one's had 4 ear tube surgeries, actually 5 now.
I guess he just had one like a couple months ago.
And that was to remove them because the last tubes that were put in were butterfly tubes. And then my other son has had 2, but it's because on the second one they took his adenoids right out with it because they were like, this will help. They did take the other one's adenoids out too on another surgery. But yeah, so I mean, big ear issues down here in Florida. But it's interesting because like the doctors said that a lot of kids have ear issues down here in Florida, and it's because of like all the humidity, all the pollutants in the air. Yeah. Like there's just so much more going on down here in this climate. And they actually did say that, yeah, like if we were up where we were originally from, like our families are originally from, they probably wouldn't be having these issues like this.
Yep, I definitely think they probably wouldn't. It's so hot down here and everything.
It's been interesting. And I know we found out my oldest is allergic to like everything outdoors.
I feel like he's sneezing all the time because you guys went out to play soccer and he just started sneezing and I'm like, oh my gosh,
I feel so bad because like we used to go hiking and everything all the time, and we used to go on bike rides all the time, and he just got to a point where he just hated it. And then of course, you know, we finally went to an allergist. And of course they were like, well, why haven't you been to an allergist before now? And I was like, well, cause we just now got referred to you. Right. But no, so they did the test on him, like where they did like put a whole bunch of different things on his back. He's like literally allergic to outside, like trees, grass, like different kinds of weeds and plants.
At least he's not allergic to the sun.
I mean, you know what? It's funny because, one of my ELA 6th graders, when I was teaching, they said they were allergic to the sun because everybody, like when I was like gone, they were like, where were you? And I was like, well, I had to take my son to a doctor's appointment. And they're like, oh, and I kind of let the kids know, like, yeah, we found out he's allergic to pretty much everything outdoors. And they were like telling me, all of them were sharing like, oh, I'm allergic to this. And yeah, I'm allergic to this. And yeah, one of them was allergic to the sun.
You know, when I was a kid, I used to tell people I was allergic to peanut butter just because people would try and make me eat peanut butter and I didn't like peanut butter. Goodness. But honestly, now I think it's just stuff in skincare that I feel like I'm allergic to.
Yeah, you just have to be really...
Because, I mean, I was even telling you, like, one of my toners literally was breaking me out into, like, a rash.
You did. Yeah, you did tell me that recently. And well, you have to be cognizant about ingredients that they use in a lot of things too. Because I know I used to be able to just kind of wear whatever makeup when I would do my makeup. But then like as these manufacturers started changing the ingredients, like all of a sudden the makeups I would use or things I would put on would all of a sudden start breaking me out. Yeah. And it's like, wait, what is happening? But no, so... kind of getting back onto like the medical stuff. We also recently found out my oldest, like, he's been complaining of like headaches since he was like 5 or 6, like kind of headache symptoms. And I would always like ask my sister about it because I was like, hey, like, I know you have migraines, like, because my sister and my dad have always gotten migraines. I've never really been someone to get migraines, or at least I thought. But I was, I would always call my sister and be like, hey, this. And I would tell his doctor when we would do his annuals and stuff. And it was like kind of one of those things, like, keep an eye on it. Like, we'll monitor it. Just kind of keep an eye on it.
I hate it when doctors say they're just going to monitor it.
Yeah. Well, it was like when he is having those symptoms, like, think about things that he might have just eaten or activities he might have just done that could have caused it. And so it's like, okay,
Wait, that was no hate to any doctor who like says they just want to monitor. I just realized someone may listen to that.
No, I think even a doctor would understand, because they're like, yeah, it is kind of one of those blanket things, but it is, but you do have to really be aware of like what you're doing and eating and drinking, or the activities you're doing, or places you're at. Because even certain environments, like, again, him being allergic to everything. But now, and within the past year, I mean, his headache symptoms have turned into more like severe migraine symptoms. And then we were told by one of the nurses that, obviously he's hitting puberty now.
Oh, great.
So the nurse was kind of explaining that, like, I'm not surprised that he's having more and more symptoms, because like
his body's changing.
Yeah, his body's changing. He's hitting puberty now. There's all these additional hormones and everything. And yeah, that's gonna cause migraine symptoms. Yeah. Which makes sense, because I think any woman that, when we're a lot of women on their menstrual cycles, well, when our hormones are changing and we have like a rush of those hormones going through our body, we get headaches a lot. It's like give me like 4 ibuprofen, please.
Right.
But yeah, so now, and that's kind of on my end. Like, again, I was never one, like, I never really got like those headaches or migraines, or at least I thought like my family does, even though they run in my family. But it's because we know now that I get atypical migraines. So like, I don't get like the average, like, oh, my head is pounding so hard I gotta go in a dark, quiet room for hours on end. Like, I actually, like, my face will go numb, and like I won't be able to talk, and then I'll get this brain fog, and I won't be able to like read or like
I know a lot of the times, like, when you have headaches, you're like, I need to go take a nap.
Yeah. And then it would eventually get to where like my hands would go numb, and then I couldn't write or do anything with my hands. So, and it's scary. And it happened to a TV news host. She was actually doing a live on air broadcast, and she was having an atypical migraine while she was live. And I know some people were like, oh my gosh, is she drunk on air? Other people left comments on that segment saying, oh my God, she was having a stroke. Like, but she ended up going on some talk shows and saying,
I feel like people should have like actually fully done their research on strokes, because I feel like maybe that's just because my grandma's experience was different.
Yeah. Well, what were some of the symptoms your grandma had?
Well, because hers was more of like stress, and she was in shock because obviously her store got robbed.
Yeah, I can see the stress there for sure.
Yeah. Well, because she was saying like everything was white, and she like felt like she wasn't like there.
Yeah.
Like, because she was like, yeah, everything was like, she's like, I could hear everybody, I just couldn't see them.
Well, and I know like when it happens, when I start having an atypical migraine, like I can feel it coming on. And it's really weird because, like, I mean, I'm aware and, like, I want to say or do things, but, like, just those actions are kind of taken away from me. So it's just, I don't know. It's really weird. But I know some of my other issues have been like autoimmune diseases. Yeah. And see, we weren't aware of my migraines. So when I did have an atypical migraine way back in the day, I was actually pregnant. I was like,
what was this, 1724? Why are you saying way back in the day?
Well, just because, I'm just so.
I mean, it's been a good year.
Yeah. It's been about 13 years since
almost
I was pregnant.
13 years.
So, But
that's crazy.
I know.
He's getting so old. I mean, look, he's literally, I think now taller than me. Like by like a couple inches.
But no, so I was having back then they didn't know what was happening. But I ended up having to get picked up by an ambulance and sent to the ER, and no one wanted to touch me because I was this pregnant lady who was having like major symptoms. But anyway, after he was born, I ended up
beautiful blessing.
Yes, I ended up having to go see some specialists because they were like, you really need to figure out what happened. And then that's when I was diagnosed with like my autoimmune diseases. And, some of the doctors were like, you probably have had these your whole life. It's just that like
it wasn't as bad.
Right. Like all the hormones in your body and everything else and the stress to your body just brought out the symptoms more so than you've probably dealt with before. And you just didn't brush it off, because I honestly, like you, I would brush everything off because
whoa. Do not compare yourself to me. We're two different people.
But I think it's a common thing for people to be like, I'll be okay. But
I think another thing for me is I was what you would consider a hospital child, because I've had my arm pulled out of socket.
Yeah, you said that you've like been kind of like the sick kid in your family.
I have, because like I was literally in the hospital for like a week and a half because I had a bone infection in my right leg, but then it switched to my left leg.
That's so crazy.
Do
they know how you got the leg infection or the bone infection?
I don't remember, because you have to think back to, I was in 2nd grade.
Oh yeah, okay.
But so the thing is my mom has had a bone infection in the exact leg I had it in.
That's weird. Like, that's a weird coincidence.
I know. Even I was like, that's like such a coincidence. The fact that it was in the exact same leg.
Is that not crazy? Well, I know, like, one of the things that I was like excited about. So I obviously, like, as you know, I quit teaching to take a remote work from home job. And I was like excited because I was constantly getting sick at school because not all students know personal boundaries and to stay out of your face when they're sick and they get you sick.
I know there was always like 20 different kids by your podium.
I know, and I'm like, guys, personal bubbles. Like, please stop. Like,
you're like, we're going back to the COVID days, 6 feet apart.
Right? I literally said that too.
You should have gotten a 6-foot ruler, and whenever they would come close to you, be like, you have to be at the end of that ruler, and I'm at this end.
Right? I mean, because I like had COVID like 5 different times.
See, I've never had COVID.
I mean, it was crazy. I was constantly getting sick. So when I did get that remote work from home job, I was like, yes. So I quit teaching, started working from home, and I was like, yes, I won't get sick anymore. Which, I mean, those autoimmune diseases, I just have a weak immune system anyway, because my body apparently likes to attack itself.
I mean, you literally blowing your nose every couple minutes. Oh my God,
the sinus issues down here in Florida. I never had this bad of sinus issues until we moved down here to Florida. I want to go back up north so badly. I've literally had to have a septoplasty done, like a sinus surgery to open up my canals.
Oh, you're right there.
They went up and they made my canals wider.
I like how I said right there, like they could see where I'm pointing.
Because our audience can see us right now, and they can.
They can definitely see where we're pointing.
No, I mean, yeah, I've actually had to have surgery to widen my canals and my nose and stuff to help things drain better, so I would stop getting as many sinus infections. It's crazy. But anyway, so kind of getting back to my working from home, I was still getting sick a lot.
Yeah.
And then I got to a point where I couldn't even work out. Like, I was like, even on simple workouts I was trying to do and exercises, it was like I felt like I was going to pass out. So I finally, and I think this is a big problem with moms, is that we're so busy taking care of everyone else that we put our own health and everything else on the back burner. And so that's what I did a lot, was like, I was just so busy taking care of the kiddos and everything but it got to a point where I was like, no, I got to go to my doctor.
Well, yeah, I remember you would like be in the middle of working out and you're like, I need to stop.
Yeah.
Like, I'm getting so out of breath. You could definitely tell how, like, you were overheating because your face would be so red.
And I'd be like, what is going on? Like, I mean, because I used to be able to work out just fine. I mean, I would run miles. I would rock climb.
Walk so fast.
But no. And so it was weird having issues like that. But no, so I finally
Listen, if you want to describe, like, how, like how fast you're walking to how slow, it's like you went from, because obviously I'm a slow walker.
You're, oh my God, such a slow walker.
I mean, we went to Planet Fitness and I wasn't even walking a mile fast.
Like
it was
1 mile per hour.
It was 0.5.
Oh, half a mile per
hour. And it's like, you went from... Oh my God. You went from... The dog said hello. It went from you walking like a cheetah fast to my level of walking.
Yeah. I would say that's a good comparison. But no, so I got to the doctor. She felt my neck and was like, "Oh, I want you to get an ultrasound." So got an ultrasound. I ended up having nodules. So they don't call them tumors when they're in your thyroid gland. They're called nodules. And I had one on both sides of my thyroid gland. And I ended up, one of them was so big that they said, like, because I had my own biopsies done because they needed to know if they were cancerous or not, which they were benign, but they said that the nodule on my right side was so big that it would basically be like putting a needle into an apple. And so it would have been really easy to just not get any possible cancerous cells in that sample. And I'm telling you this, if they tell you that you can drive home after getting a biopsy on your thyroid gland, they are lying. I'm so glad my mom was down here helping me, because there's no way I could have driven home after that. I was in so much pain. And I'm like, no, like that. I would never do it again.
Your mom literally had to talk for you.
Yeah, I couldn't even talk. I was in so much pain. It was terrible.
She couldn't even say ow. That's how much pain she was in.
It was so bad.
It's funny because you tried saying ow and you go ow. You go ow.
Yeah.
Like that hurt even worse just saying ow.
It was crazy. But no, so they basically were like, the specialist was like, basically I had hyperthyroidism and with those nodules, and then I didn't know it, but I had Graves' disease as well. The specialist that did the surgery on me had asked me.
I didn't know that.
Yeah, he had asked me. He's like, "Have you ever been diagnosed with Graves' disease?" And I was like, "Well, no, I never. No one's ever said that to me." But the blood work had come back and it did show I had it. But they removed it. So guys, I had surgery because at that point, the hyperthyroidism was also causing heart failure. So it was like, we got to get that out, because it was like, you can either, deal with this and all these other issues we can try to treat, or we can get the surgery, get everything out, and just get you on medicine the rest of your life, and get everything kind of back to normal with that treatment plan. So, but yeah, even the doctors were like, yeah, no, we got to get this out. Like, we got to get you better. So it was one of those things how it was just like, we got to get you better. So I did. I had the surgery. I'm still recovering.
It looks really good.
Yeah. All the doctors I've been to since, because of course, even my primary care provider and the other specialists are like, oh, do you mind if we look at it? And so I'll show them, because it is like a scarless surgery. But yeah, it's not it's because they make the incision
where your regular neckline is.
Right. They kind of try to blend it in with your regular neckline.
But I feel like even though you had it covered up right after you had surgery, I feel like even when you took the bandages off, you couldn't really tell. It's like you just had you burned yourself right there. Because obviously it was pink.
Right. And when it's out in the sun, because I have to cover it. They said to cover it for the first full year because it's like baby skin when it's healing.
Yeah.
You can tell if the sun's on it. You can definitely tell. But that's why my voice kind of goes in and out sometimes still, because I still have a lot of swelling.
I know,
in
you'll
my
be like
throat and my neck. I know, I do that a lot. And my throat still hurts a lot when I talk to sometimes. Sometimes it'll really, really bother me, and I'm like, oh my gosh, I need to numb my throat. I need my cough drops because I eat them like candy. And other times it's like,
You're so
okay,
good,
like
though.
I can have a normal conversation and it's not really bothering me that much right now. But they let me know that it's going to take me up to like a year to fully recover. So I'm just kind of waiting for all this like inflammation and swelling and everything.
Can we talk about the fact that I banned you from having cough drops on the episodes?
Yeah.
Because listen, and it's not like I'm like, no, you're not, you can't talk normal. It's the fact that when she eats cough drops, oh my Lord, you can tell she's eating cough drops. She's like,
because I like to kind of chew them. I like to get them to a certain size to where I can like start to kind of like crack it with the back of my teeth, and then I can put them into like a bunch of smaller pieces along the back. And oh my God,
so loud.
I love my cough drops.
Listen, I didn't really understand the hype of like your cough drops until I had like I was doing choir. We just had our choir concert, so my voice was like done. And so I had one of your cough drops. Like,
I know, yeah.
And then I started buying them, which actually,
I know. A lot of kids started buying that particular brand. Yeah,
I know. I get that exact one like you get, but actually, with obviously my biopsy down my throat was so sore. They even told me they were like, it's gonna be sore for a good couple of days. And those cough drops, let me tell you, those cough drops helped so much, like with my throat and everything. Like I feel like I was eating them like candy.
Yeah, I mean, because I would get them at one of the big box stores, like the big bags, and so a lot of you guys would be like,
it started with me.
I'm just gonna get some cough drops out of your bag. I'm like, okay.
See, it started off with me, and then like a couple days later, I don't remember who saw me with it, and then you're like, oh my God, I want one. And I looked at you and I was like, that's your doing. I'm going back to my history class.
And it got to a point where so many kids were wanting cough drops that I was like, guys, like I literally just bought this bag of like
special though.
It was like, it was a bag of like over 200 cough drops, I want to say. Now they make 2 smaller bags that you have to buy together. But back then it was like one big bag. And like the bag was almost gone. And I'm like, guys,
listen. They would eat all of her cough drops and all her candy.
Well, yeah, but I mean, I would get candy for them, though, for participation, like to help engage.
I'm
like,
sorry.
Whoever would answer questions, they would get candy.
Where was that when I was in your class? Listen.
I did that with your grade level.
I can't say what I'm about to say.
I did, yes.
BS.
Yeah. Oh, no. Because remember our one friend that likes to steal everything from people got into my stole 2 big things of candy.
That's more of... your hand was like really close to me. No, but honestly, you didn't do it often as much as you did it with them.
Because I had a teacher salary. I mean,
but like I'm saying, like, because with them, you would buy the same candy that you bought like 7th grade year too.
Yeah.
But it's like you did it more often with them than you did with us.
Well, I mean, the teachers got a raise that year, so I could afford a little bit more.
Of course, they gave her a raise the year she didn't have us. But it's okay because my reading teacher goes, dang, Janessa, I'm going to give you diabetes because I love... Listen, that's the only way I would really read in her class is because obviously she would do it for people to read. Right. But honestly, I didn't really have a problem reading because even in like high school, like nobody in my second period would read at all. And I would read like basically the entire story. Because she's like, does anybody want to read? And I'm like, I guess. And she's like, do you just want to read the entire thing?
And I had kids like that too, where like no one wanted to read. And it's like, okay, I'll give you some candy. And then of course, like everybody's hands would go up. Yeah. But anyway, so yeah, everybody loved my cough drops. And they, honestly, a lot of kids started having their parents or grandparents or whoever they lived with buy them their own. And they'd be like, oh, look at this flavor that we got. And it's the same brand. And I'm like, oh, I haven't tried that one.
The regular one is better.
I do. Yeah. The original is the best in my opinion. I mean, I do like to get the lemon ones. But I really do love the herb flavor. But anyway, so that's just kind of some of the health issues that we've had to deal with. And of course, I'm still recovering. So if you guys do hear me on the podcast, kind of like trying to clear my throat or anything like that, it's because I am still recovering. And I still have another good, like 6 months about to recover. But no, but we just kind of wanted to bring some awareness because I think, again, it's really easy for everybody to push off.
Make sure you drink energy drinks while you have heart conditions.
No, don't do that. Don't do that. I mean, we are not doctors or anything.
Drink energy drinks while you have heart issues.
But she likes to drink energy drinks.
Specifically Alani's. Listen. That should be a poll. What's your favorite Alani? Comment what your favorite Alani is if you drink them. Her mom gets on to me all the time about drinking them. She's like, "Why are you drinking that? You have heart issues." And then I like purposely drink it right in front of her, and she's like, she like shakes her head at me, and she's like, "You shouldn't be drinking that." Actually, my mom threatened to call the doctors on me before.
Oh yeah, she should. Well, I can put a poll in there. Like, do you like to drink Alani energy drinks? But no, how about we put a poll on this podcast episode asking people if they've ever pushed off going to the doctor?
Yes.
So I think that's what I'm gonna do.
I feel like a lot of people do.
I
feel like especially like older teens and adults do.
Oh, for sure.
I feel like with little kids, like their parents, like especially you, not saying it in a bad way. It's like as soon as like their kid's like sick, like they immediately take them to the doctor.
Right. Yeah.
Which is good parenting on your guys' part.
Yeah. It's just we gotta take care of ourselves too. So guys, if you know any family members or friends who really need to go to the doctor, I keep bothering them, keep pestering them until they go.
Yeah, I did that with my uncle, and now he went.
Right. Yeah. Let them know you care. But we will go ahead and end this episode. Feel free to visit our website, adocpodcast.com.
And our social media.
And